Hello, it's Bruce Williams again. Today I'd like to present part 4 of the selected gross pathology of mice and rats, and we're going to talk about the gross pathology of the integumentary system of the mouse. And before I do that, I want to thank, as always, my friends and colleagues who have provided me their images freely over the years through online collections and directly, who've done such a great job for the foundation, and I hope to do as well as they've done for me over the years. Okay, let's start with a case of suppurative blepharoconjunctivitis or periocular dermatitis in an inbred white mouse. This is a common finding in a number of inbred strains, not to mention the immunodeficients, but I'll tell you why in just a second on them. BALB-Cs, 129s, and J-crosses are predisposed. Now, this could be a number of different agents. Obviously, Staphylococcus and Streptococcus are both agents that are commonly seen in the environment and can result in blepharitis. You can also see cases of blepharitis as a result of infection by Corynebacterium cucuri, very common commensal in just about all mice and rats, which tends to be expressed in large numbers when the animals are immunosuppressed. One that can cause an agent that shows up from time to time and causes a tremendous suppurative response is Pasteurella pneumotropica. And we've already seen large pulmonary abscesses. And in the eyes, the abscesses resulting from Pasteurella pneumotropica infection may actually result in the loss of the eye. You can occasionally see Pseudomonas and Mycoplasma as agents of blepharitis as well. I did mention how immunodeficient mice get an increased amount of blepharitis, and this is not only because they're immunodeficient and have decreased cell-mediated immunity and the decreased ability to fight infection, but also they're hairless. They're not truly hairless. Hairless comes out, but as it emerges, it tends to break off. And nude mice don't have eyelashes, and eyelashes are the first defense against ocular infections. They tend to have an increased amount of foreign material which gets into their eyes and sets them up for various forms of blepharitis. Here's a couple great pictures of a large nodular mass within the dermis of a mouse. Here's another mouse, similar location, and you can see that the mass is firm on cut section. It cuts very easily. The morphologic diagnosis would be pyogranulomatous perinasal dermatitis. This is a very common location for a cutaneous infection that's mediated primarily by Staphylococcus aureus, rarely by Pseudomonas, and the name of the condition in mice is Barriomycosis. Barriomycosis comes from the Greek word for grapes, and was named this way because on cut section it has this sort of proliferative response with foci of bacteria which are encased with brightly eosinophilic material. Some people call it splendor or hopley material. It actually is aggregated antigen and antibody complex that the body throws at these bacteria. It has trouble clearing. In order to encapsulate them, there's a profound chronic response, and these particular lesions continue to grow. So they're not only facial, you can see them throughout the body, all over the skin and underlying soft tissue, occasionally getting into the bone. And Barriomycosis is a term that applies more to the appearance of these colonies surrounded by splendor or hopley material. You will see it occasionally used in other species in various lungs. So it's not specific for mice, nor is it specific for skin infections. However, that is the most common usage in veterinary pathology. These are essentially deep abscesses that have been walled off by a profound chronic inflammatory response and fibrosis. As we said before, Staph aureus is the most common cause. Other forms of staph, including Staph hominis and xylosis, have been identified. Pseudomonas aeruginosa, Proteus species, which occasionally will get in the skin, and Pseudomonas aeruginosa, E. coli, and nocardia all have been identified in cases of Barriomycosis Barriomycosis. Here's another case of staphylococcal pododermatitis resulting in Barriomycosis. So it's not simply confined to the areas of the face. Certain strains of mice, especially genetically manipulated ones, and immunodeficient animals may be predisposed to developing Barriomycosis. Urokinase plasminogen activator deficient mice are predisposed, probably due to the unfavorable conditions in the microenvironment and the inapparent or ineffective wound healing that is seen in these particular animals, which tilts the balance over to the side of the bacterium. It's also been reported in humans with HIV infection and chronic granulomatous disease. Histologically, it's a very simple diagnosis to make. A nice gram stain will usually illustrate the gram-positive nature and the cockle shape of the bacteria, but most people don't really even bother with special stains in this particular entity. If you're working with B6 mice, this is a condition that you are probably going to see and probably see on a regular basis. There's multifocal ulceration, necrosis within the skin of this particular mouse, and the condition name is multifocal ulcerative dermatitis of B6 mice. And this is a multifactorial disease that is well known in this strain. So genetics are obviously playing a part here, but there have been a number of publications over the years pointing at other possibilities, including sensitivity to ectoparasites, an immune-mediated leukocytoclastic vasculitis, and then the condition is often worsened by secondary bacterial infections due to Staphylococcus aureus. It's usually seen more in females than male. It is seasonal, with peaks in the spring, the fall, and the midsummer. A number of dietary components have been postulated, including vitamin E deficiency as well as vitamin A deficiency. So this one is another condition in the mice that is well known but not well worked out. Okay, classic condition of immunodeficient mice is hyperkeratosis due to infection with Corynebacterium bovis. On this particular animal that you can see that there are large confluent hyperkeratotic crusts. This condition, which is occasionally called scaly skin disease, has been seen in some colonies in up to 2% of nude mice. It is a disease that is associated with immunodeficiency, not with the fact that these animals are hairless. There's marked hyperkeratosis because the agent Corynebacterium bovis rarely staph xylosis, which has also been identified in one colony. But Corynebacterium bovis is a lipophilic bacterium, which lives within the lipids that hold our epidermis together. As squamous cells are desquamated to form the stratum corneum, they are anchored in place by the lipids, which are extruded from these cells and form sort of like the mortar in a brick wall, holding these cells together. During normal desquamation, these lipids will break down, and the cells will desquamate singly, individually, maybe in very small clusters. But when these lipids are either defective or there is infection and difficulty extruding these lipids, then the cells will hold together longer than they should. They will be desquamated in large plaques, and this is what we see with hyperkeratotic scale. So this is Corynebacterium bovis. It can be fairly easily demonstrated with a gram stain on areas of the skin. And while you might think that here's another more severe case with large plaques of hyperkeratosis, and while you might think that this is a sort of a benign disease, this can actually be fatal in affected mice as a result of dehydration due to abnormal transepidermal water loss. So Corynebacterium bovis, scaly skin disease, occasionally seen in nude mice. One of the diseases that you definitely do not want to discover in your mouse colony, and this is one that might sneak out through or sneak in through infected biologics, is a poxviral condition in mice known as ectromelia. The disease name is mousepox. The virus name is ectromelia. It is a pox virus which demonstrates all the same features as some of the other more pathogenic pox viruses that we see in humans with smallpox, and sheep and goats with sheep and goat pox, and camels with camel pox. Pox virus is seen in many different species. There are a lot of pictures out there, usually involving the skin, and we think that it generally is not that severe a disease. But in reality, the epithelial infection that results from pox viral infection is not only confined to the skin, but also also is seen in internal organs as well. The ectromelia virus causes a extremely aggressive cutaneous infection, resulting in widespread lesions, which often result in severe blistering, necrosis, and even sloughing of the extremities, feet, toes, digits, tail, ear pinna. But also the lesions seen within the animal, such as liver and splenic necrosis, are very characteristic for this lesion and attest to the pathogenicity of this lesion. Identification of this virus within a colony usually results in total depopulation because of the difficulties in controlling it. It's going to have a high mortality rate anyhow, so you're not saving a whole lot by not depopulating. It's enzootic in Europe and Asia, and usually in other countries. It does, as we said before, come from the importation of infected mice or mouse products. Some strains are resistant to mousepox, including C57 blacks, 129s, and some are very susceptible, including the DBAs, the A's, the C3H's, and the BALB-C's. Highly susceptible strains usually don't survive long enough to develop skin lesions after they get infected. This is usually the province of animals that are either of moderate or some resistance to the particular virus. Here's a nice image showing the actual loss of a leg. This is due to severe infection of the epithelium, and as we see here, the skin of the tail is also infected, and we have these sort of concentric areas of necrosis, and the rest of the tail and this particular leg, because of the necrosis and the constriction band that's formed, will undergo dry gangrene. The virus, as most orthopox viruses do, does not infect the mesenchymal tissues or the soft tissues and the bone. But the necrosis, the drying, and the restriction that is seen in localized areas of necrosis can result in ischemia to the remainder of the extremity and loss of the extremity. This is one of my absolutely favorite pictures from Dr. Dean Percy, and this must have been a well-loved mouse because all of its lesions had healed up. I call this one waiting on a prosthesis. This is a classic lesion associated with ectromelia virus infection. The other thing that I want to mention is this lesion looks very much like a lesion we're going to look at in just a minute, ringtail, and this will remain one of your differentials for ringtail. The possibility of ectromelia virus in a colony should always make you think, could this be the day? Okay, so this is a great picture of a condition that is known as ringtail. I think Dr. LaPearl calls these annular constrictions, and it is a multifactorial disease that traditionally has been associated with low humidity and high temperature, but it appears there are a number of other conditions that can cause similar lesions. We looked at ectromelia, and I think that there is a growing body of evidence that low humidity and high temperature are not the only ways that this particular lesion can be caused. There was a very nice article in a VetPath within the last year, which identified a localized cornification defect resulting in deficient desquamation of cells in annular bands on the tail or on the digits or feet, where you can also see lesions, which results in a sort of a restrictive band of skin, which cuts off local blood flow, resulting in either death in a very segmental area of the tail, or maybe even sloughing of the tail. So this is a cornification defect. It's been identified as causing disease in some types of mice with these lesions. The other issue that might cause that conceivably is bedding. Some people want to use comfortable cottony bedding, and threads or pieces of bedding can get wound around the tail, especially of very young mice, and cause restrictive lesions. So that is something that probably also needs to be considered. The possibility of frostbite's an unusual one. Maybe the animals are left outside when they're shipped, but probably doesn't happen very often in today's laboratories. And then foci of necrotizing dermatitis due to bite wounds, which may be secondarily infected, can also cause a lesion like this. If I was sitting for some type of certification examination and I was asked the cause of this, I think I would go with what is commonly cited in the books, and that is low humidity, high temperature in the ambient environment. Oh, here's nude mice, and they're cute, and you would think that they spend most of their time covering up their naughty bits from view. But as opposed to what Walt Disney tends to say about mice, they can be a very aggressive lot, especially the males. And this is a nude mouse with traumatic bite wounds. This is usually seen in adult males caged together, and some strains of mice are well known for their pugilistic tendencies, including Balbcies and DBAs and Swiss mice. So don't ever rule out fight wounds, especially here on the back or the tail. The animal that turns tail first will usually get bit in it. And fighting mice don't do well with a timeout. If they are seen fighting, never put them back in the same cage, because they are going to fight again. Here's a lesion that we saw earlier when we looked at Barriomycosis, but I didn't mention it then. And you probably said, why is he not mentioning all of that hair loss around the face? Because I was waiting for right now, and here are a couple of mice who have undergone a process known as barbering, also known as the Dahlia effect. And you can see these patches on the face, but it could be anywhere on the body, in which the hair is basically plucked by another dominant, often female mouse in the cage. If you take a close look at the skin, you could not cut this hair any closer. It is cut absolutely flat with the skin, like somebody took a very, very, very tiny pair of sharp clippers and clipped those areas. And the distribution here on these two mice is very, very important because of the utility that mice have and the importance that they have for their whiskers and their eyelashes in investigating their environment. The best way to absolutely humiliate a mouse and to debilitate that mouse is to remove the hairs, the vibrissa of the whiskers and the eyelashes. And we already mentioned the importance of eyelashes in preventing ocular infection. So this was a very dominant female mouse who found the exact way, and it's a pretty easy fix to figure out exactly which mouse is doing it, because that's the one that's not barbered at all. So take that mouse out, put it in another cage by itself, and see if the hair does not grow back. The same thing with fighting. You can remove a fighter, you can remove a barberer, and oftentimes due to a social stratification, another animal is going to take its place. So removing the initial offender doesn't always solve the problem, but this is barbering. B6 mice and A2s, they tend to be a little bit more predisposed to this. And here's another animal that's been barbered, and we have a large area of ulceration in the area of the whiskers where it's probably being barbered. This relates back to the slide that I showed previously of Barriomycosis, how both of those lesions were in the areas of the whiskers. And Barriomycosis, because of the environmental contamination of Staph aureus, can commonly occur following barbering in certain areas of the body, and the face is certainly one of them. So those two tend to go hand in hand, Barriomycosis and barbering. Of course, this could also be the animal's being barbered. Maybe this is a separate lesion due to scratching it on a cage, trying to get to water or something like that. But I think the two are going to be pretty well connected. Okay, we're looking at the top of a white mouse. Of course, this could be a fight wound, but this is a very characteristic location in animals with ectoparasites or ectoparasite sensitivity, and we saw that earlier in association with B6s. But this area at the back of the neck between the shoulders is sort of a classic location for ectoparasites. And there are a number of fur mites that mice will get, and it can be very difficult to eradicate from a colony. So the ones that I usually remember are Myobia musculi, Myocoptes musculinus, and Radfordia affinis. Myobia musculi is the one that has a predilection for the shoulders and the head, but I've seen this lesion in association with other types of mites at all. In a pet store situation, these mites are not all that selective, so they're not species specific, so you can see similar mites on hamsters and gerbils and even guinea pigs kept in close proximity. Mice also do have, they do get mange. The most common mange mite that is seen in mice is Shorogati simplex, the follicular mite. And under the microscope, the hair follicles will be greatly distended and have numerous mites within them, almost looking a little bit like comedones. They also do get notoedries in and around the ears. So, just a couple things of mites. And while you're looking at that, you can also see mites on immune deficient animals as well, just not as commonly. Here's something that I don't know if I've ever seen in the wild. It's probably very, very uncommon now in laboratory mice, and this is lice. Lice, the common louse of the mouse is Polyplaque serrata, and basically it got its fame by being the vector of the blood parasite Epeirithrozoan coccoides. Remember, in the pig, Epeirithrozoan suis is also transmitted by the louse, in that case Hematopinus suis. It takes a louse to transmit Epeirithrozoan. None of the fur mites, even if they bite the animal, can transmit that particular parasite. Usually the infection with lice in most species is going to be totally innocuous and unseen. And then if you have a mouse that you're posting for any other reason and you put it on the light tray and you walk away for a couple minutes, you may come back and the lice, which normally are adherent to the skin, have noticed that the light source is warmer than the body of the cooling out animal, so they will climb up, as we see right here, to the ends of the hair. Oh, here's a funny looking nude mouse, and this animal is sort of a water balloon because it has severe subcutaneous edema or anasarca, and we've talked about the problems that old rodents have with their kidneys. Immunodeficient mice often will have amyloidosis as well. I think you have to consider the possibility of cardiac insufficiency here, but I would take a very, very close look at the kidneys in terms of either some form of age-related glomerulonephropathy, and all old rodents have old rodent kidneys and they're terrible, and you get changes in all levels of the nephron, a lot of protein wasting, and the possibility of amyloid, which accelerates that process and brings it to a much more severe level, should be considered in cases of subcutaneous edema. Oh, here's a nice picture that was sent years ago by Lauren Ritchie. Just a cute picture. And this is it's an appearance more than a specific, it's not a specific type of mouse. This appearance of the quote-unquote clown mouse has been seen in many different strains. Rarely its association with viral infections like mouse hepatitis virus. And you can see it in one animal or the entire litter. And these animals have a variable alopecia and hyperkeratosis. And these animals usually have undergone some severe systemic disease from which they have recovered, but it's resulted in a temporary cessation of normal hair growth cycling. And when they do come back and start growing hair again, hair tends to grow in from the front of the animal back, from head to tail. So regrowth appears first around the head and then progresses posteriorly. This is a little wild mouse, and it's just showing the changes associated with the clown mouse appearance. Oh, if we're going to look at funny-looking mice, I guess we should talk about the Rhino mouse. The Rhino mouse is a phenotype, a very extreme phenotype of hairless mice. It's also immune deficient. It gets conjunctivitis and blepharitis. But what makes the Rhino mouse very popular in various types of research dealing with the skin, even in research dealing with development of various types of hypoallergenic makeups, is that the animal has these utriculi, or very dilated follicles that are filled with keratin, which sort of give it this lumpy, bumpy appearance. I think the most appropriate morphologic diagnosis would be diffuse follicular dyskeratosis with cyst formation. And just a slightly closer look at this animal, just the presence of these large keratin-filled comedones results in overall thickening of the skin. You can see some of these individually on the surface of the affected animal. Notice that this is a hairless mouse, but it's not truly hairless. There are hairs within some of these follicles, and it's not uncommon to see them in nude mice, but the hair shafts are somewhat dysplastic. They tend to break as soon as they emerge from the skin. So nude immunodeficient mice are neither nude nor are they generally immunodeficient, but they're as close as we can make them be. Papillomas. This was an animal that was a transgenic mouse which was treated locally with a carcinogen promoter and ended up with large numbers of papillomas over the areas of the body that were treated. We used to have to paint these animals to get something like this. Now there are a lot of transgenic mice which develop these on a regular basis at a very young age as a result of KRAS mutation. So as I said before, you can make a transgenic mouse do just about anything you want, as long as you know which gene to knock in or to knock out. Here's a very special strain of mouse, the FBVB mouse, which is used for a number of things, including a lot of transgenics because it has a very large pronuclei in the eggs. But one of the things that it does have is they have a fair number of neural crest tumors of the neural crest, which appear either in the on the tail or occasionally on the pinna of the ear. FBVBs are also well known for development of the space cadet mutation, which causes disorder and degeneration within the cerebrum, certain areas, and animals that act like space cadets. And also they're very commonly known for their retinal degeneration. But this is a common tumor that's seen in this VB strain of mice. And there's a neural crest tumors. This is a very old picture. And science is getting farther and farther afield, and now we can take tumors from a human tumor patient and put the cells into nude mice, and we can actually grow up antibodies against them, sort of an individual treatment. But this is back in the old days. Certainly it's better than what we had to do even before that, which was to implant tumors into the cheek pouches of hamsters, and no one wants to dig around in the mouth of a hamster for any reason. But their cheek pouches are somewhat immunoprivileged sites, and this is just an animal that has many. Because of their deficient cell-mediated immunity, we can take neoplasms from other mice, actually from people, and implant them underneath the skin, and in the vast majority of cases they will grow quite well. So the development of the nude mouse was just a major boon for cancer research everywhere. Okay, one last picture, multiple hemangiosarcomas, and just to say that mice will get the full range of tumors of all types of animal species. If you're presented with a tumor, I would go to the in-hand nomenclature site, which is run by, or at least co-run by, the Society of Toxicologic Pathology. There's also a group that in the Journal of the Society of Toxicologic Pathology, that's the JSTP, not ToxPath, but the JSTP publishes on a regular basis a series of consensus papers that was started at the AFIP many years ago, back in the early 90s, and has been extremely successful, in which pathologists get together and they go through the initially they were proliferative lesions. They broke them out to neoplastic and non-neoplastic of 13 different systems. And they periodically will publish the accepted nomenclature and descriptions for these tumors, so you can always make sure that you have the most up-to-date nomenclature and how to break down these various lesions. So I give that 2 thumbs up, a very high recommendation. That is the INHAN, INHAN guides for proliferative lesions in mice and rats. And a fantastic resource that is available. So that brings us to the end of the lesions of the skin of mice. In our next lecture, we are going to talk about the looks like the reproductive system. I had to jump forward there. So reproductive system, and that's a great system too. A lot of good things to talk about. So thanks for tuning in. I appreciate you turning us on today, and I look forward to putting more lectures, and the foundation really appreciates your patronage and making these various lectures a very popular part of our international outreach. Hey, I hope everybody has a great day.